action. Hi y'all, my name is Sonya. I'm here to inform y'all about what is hyperbarics. Hyperbarics is a medical treatment which involves administering 100% oxygen to patients in an environment of increased atmospheric pressure known as the hyperbaric chambers. The process works as it increases levels of oxygen. It enters the blood and the body tissues where it promotes healing. Hyperbaric medicine utilizes chambers which can operate at up to 3 atmospheres absolute pressure. The chambers are constructed of clear acrylic plastic and will allow the patients to be viewed by the staff, and they can watch TV. And the staff can actually, we can assess them to just see how are they doing. Okay, y'all. The history of hyperbarics, it started like in 500 BC. It started by the Greek divers. The Vincium diving suit was like in the 1500s. Burial breathing system was in like the 1680s. That was a rebreather. That's what the deep sea divers would go underwater with all the hyperbarics, and then they'll come back up. Halley diving bell, that was made in the 1691. The diving engine in 1715. Divers breathing device was in 1808. Now they got some hyperbaric pioneers. That's people that dealt with hyperbarics over years to come. Starting like in the 1870s. Paul Bert was a French philosopher. Disease on bends. This is where people was exchanging nitrogen. Wasn't getting enough nitrogen and oxygen mixed exchange so they could do better. Recommended slow decompression rates, then they recompress them, and then they decompress them again. They let them got all that nitrogen out of their lungs. Because if you have too much nitrogen in your lungs, you cannot breathe. You need carbon dioxide. Fontaine is a French surgeon. 1879 built a pressurized operating room. That meant he built a pressurized hyperbaric chamber with 100% oxygen when he opened up somebody's body. He cut them. It was already getting 100% oxygen, so that helped them heal and sealed much better than what they was doing. He used nitrogen oxide and anesthetic elevated pressure allowed for the deep surgery anesthesia. J.B.S. Haldane, he was a British philosopher. In 1890 began studying decompression sickness using goats and animals. Before he did his treatment on humans, he wanted to see how it worked on animals. Developed his first scientific-based decompression table. It discovered bubbles formation in the blood and tissue. Usually, if pressure is reduced by less than 100% of the total pressure. Okay, before we give anybody hyperbarics, we gotta have consented treatment. The most treatable side effects of hyperbarics is your ears get full. It's like when you fly on an airplane and you get like, your ears get full. Like a lot of people get full ears with sinus. It's like fluid buildup. Well, that's what you get in the hyperbaric chamber. Then you get confinement anxiety. Actually, the chambers almost look just like a coffin. So when you're laying on your back and closed up like that, you actually get kind of nervous and it's just very hard to relax. But you can watch TV while you're in the chamber. Temporary slight blurred vision. Some people say they don't get blurred vision. Most diabetics do because they already have something with their vision. And if people already have glasses and stuff, we tell them don't change your prescription because your vision getting a little blurred while you're in the chamber, because it will recorrect itself. You might have a little lightheadedness because you're laying on your back. And then once you get up, you normally gonna come back to pressure. And like a little bit of muscle discomfort because you're laying in that position for a long time. Well, for like 90 minutes. Okay, preparing for the treatment. Hyperbaric therapy treatments are administered daily and requires patients to be present for approximately 2.5 hours. They say 2.5 hours. It's really like an hour and a half. You get there to get prepped and get changed and everything. You will be seen and elevated by staff, evaluated by staff before and after. We take blood pressures. If you're diabetic, we take blood sugars. We check your clothing. You got to be 100% oxygen. You can't have nothing in your pocket. You can't go in there with no reading material. You can't go in there with no glasses. So it's like we change everybody into 100% gowns and then we put them in a tank. You can't smoke 2 hours before or 2 hours after you get out the tank. You're supposed to eat a regular meal. And if you have an existing wound, you know, we cover the dressing to make sure. Safety precautions, we pressurize at 100%. So we let everybody, that's what the form of consent does. It lets you know what you can and what you cannot bring in the tank. Because if you do bring it in the tank, you have the chance of blowing you up and everybody else in that chamber. And we have a 6-unit chamber bed, a six-bed unit. So everybody's at risk. The people in the other chambers and all the staff that's in there monitoring. And we are actually like one tech per chamber. Well, one nurse per chamber, because we need like 5 nurses at a tech. Now they got different phases of treatment. You start off with your compression phase, your prescribed time and pressure, and your decompression. Now with those stages, that's where your ear popping coming in. Like the first stage, when you first get in there, we first turn the machine on, your ears gonna get full. We tell everybody, let's try to pop your ears. You can hold down on your nose like this, like you gonna sneeze. But don't sneeze, just hold down the pressure, and your ears will start popping. Then we give them some gum. You know, everybody is different, so everybody, you know, we just do a change of pace with everyone. Okay, I did the safety. And the side effects, you got temporary blurred vision, like we said. That's the main thing. The blurred vision is what really worry a lot, because sometimes it goes longer than the popping of the ears. Now, if you can't pop your ears actually, you can put some tubes in your ear. Things that can be treated by hyperbaric therapy. Axaminosis, carbon dioxide poisoning, gas gangrene, that's a big one. Preparation and prevention of compromised skin flaps. That's like when you go for a bilateral BKAs and AKAs, people that got trouble healing. Acute traumatic peripheral ischemia, blood clots, and different things that we try to prevent. And this is the last thing. I just want to show y'all a picture of the hyperbaric chamber. This is what we have in our unit.